My name is Matt Florek, and I work at Olmsted Medical Center in Pine Island. As part of my practice, I see kind of all ages, from well child visits and teenagers, women's health, adults, chronic care management, lots of different things, really all ages, and general primary care is what I see. I like to do orthopedics. I do a lot of joint injections like knees and hips and elbows and shoulders. Do some skin procedures as well, like biopsies and skin cancer excisions and things like that too. I became a family doctor because I've always been really interested in the human body and just the science of it and how all the parts kind of work together and how it's been just beautifully created. And that's always intrigued me. And then as a family doc, I also get to work with patients on treating that body and making it work as well as possible, relieving suffering, and just improving its function as best as possible. So I get to kind of bring in both the science and the relational part of it together. Before my patients come and see me, I'd like them to think about what they want to get out of that visit. Really want them to think about the question that they have for me or the problem that they're having, and kind of bring that forth honestly right away at the beginning of the visit, so we have as much time as we can to work through that together. So it's important to me to have a good connection with my patients so that we can work well together and I can really understand what they're dealing with and what they would like me to help them with. It's a very intimate connection between a doctor and a patient. You have to really know them well to know what's important to them and what their goals are in order to most effectively work with them and improve their care. I think the most satisfying part of my job is feeling like I really made a difference for a patient, really being able to meet them at a point where they might be at their most vulnerable or might have shared something very difficult, and be able to work through that with them and I really feel like I made a connection there. Outside of work, I have lots of hobbies and things I like to do. I wish I had more time to do all of them, but I really love distance running. That's something I do every day for my own health and wellness and mental sanity. I like to get out and run every day. I also like to travel and spend a lot of time with my family. So I have a beautiful wife and 3 beautiful kids, and we like to travel all over Minnesota and the Midwest and spend time with family. But I like coming to work at Olmsted Medical Center because I think we do a really good job taking care of the patients and really focusing on primary care. We're also very focused on community, both community that patient comes from and lives in, but also the community within the providers at Olmsted Medical Center. It's very easy for me to discuss care with another provider or a specialist in a respectful way, and we really work together for the good of the patient. And so I really enjoy that. It makes it fun to come to work every day.